This slide and the next slide is really just a review of Chapter 1. This slide talks about inspiration that happens because the intercostal muscles constrict, the thoracic cage goes out. Due to Boyle's law, air fills the alveoli. And then on the next page, it talks about expiration. You can read through that. It's just a review of Chapter 1. Chapter 3 starts talking about trigger and cycle. For now, we're going to start talking about trigger, and I want you to understand that trigger starts a breath. Trigger initiates a breath. Trigger is something you set on a ventilator to start a breath. And the first thing that we're going to talk about is time trigger. And guess what? After a certain amount of time, the trigger starts a breath. As I said on the previous slide, whenever we use time trigger, you set the respiratory rate. By setting a respiratory rate, you're actually setting an expiratory time. Back in the old days, when Jennifer and I were in school, we didn't have a vent where you set a respiratory rate like you do. You turn the knob and you say, I want a rate of 12. Your rate is 12. We had to figure the expiratory time and the IE ratio, and based upon those two, we knew what the respiratory rate would be. So whenever you're setting the respiratory rate by turning that knob to 12, in essence, what you're doing is you're telling the computer to calculate the IE ratio and the inspiratory time, and the expiratory time is there left over for by which the respiratory rate should be 12. I know that sounds confusing, but it'll make more sense on the next slide. So by setting the respiratory rate, you're telling the machine the patient will take a breath and then exhale. After that exhale time is over, that's when the breath starts. And that's the time trigger. After that exhale time is ending, the breath starts. The next slide I think will help make more sense to you. Hopefully after this slide, the time trigger will make a little bit more sense to you. Okay, so what you do is, let's say you have a respiratory rate set at 12. The vent will deliver a breath every 5 seconds. How do I know that? Well, there are 60 seconds in a minute, and they're going to get 12 breaths in that minute. So I take 60 divided by 12, and you get 5. That means that every 5 seconds, the ventilator will trigger a breath or start a breath. So what if the rate is 15? Take 60 divided by 15, and you get 4. That means that every 4 seconds, that ventilator is going to trigger a breath. The next example is 20. If you set a respiratory rate at 20, that patient's going to get a breath every 3 seconds. 60 divided by 20 is 3, so the breath will start or trigger every 3 seconds. The next example is 30. 60 divided by 30 is 2. That means that every 2 seconds, the ventilator will trigger a breath. And then you can figure 10 and 8. Hopefully that makes sense too.